morning and welcome to Health Chat. I'm Karin Carroll, the Public Health Director for the City of Gloucester, and I'm here today to talk a little bit about a public awareness project that we're undergoing through the Health Department. It's a regional effort, and we're going to be talking about the harms of underage drinking. We've done some background work, and I'll give you a little bit of the details and tell you about the program that we're going to undertake here in the region. So through some YRBS surveys and other regional surveys that were conducted, our project leaders through the Health Department identified that alcohol was the number one drug of choice, that approximately 40% of high school students drink alcohol, and that it's one of the easiest substances to obtain. So through the Department of Public Health, the Health Department wrote for and received a grant called SAPSI, and it's to focus on underage drinking within the region of the North Shore, or actually Cape Ann. So we include Manchester, Essex, Rockport, and Gloucester. And we formed a coalition of school principals, school members, community members, health departments, various stakeholders in the community concerned about the issue of youth and underage drinking in particular. The coalition decided about 6 months ago that they wanted to undertake what's called a sticker shock campaign. And we're going to explain to you what that is and what it looks like and how it will roll out in our communities in the coming weeks. But first of all, I wanted to also give you a little background about some of the additional information we found from our surveys. When we dug deeper with the youth, we found that most youth were accessing alcohol through older friends or siblings who were purchasing it for them. So this gave us a starting point of this group of sort of 20 to 30-year-olds, 21 to 30-year-olds, who are able to legally buy alcohol for themselves, but who might be supplying to folks who are underage. So we wanted to reach out to that target group to help them understand some of the risks that are involved with youth and providing alcohol to youth for both themselves and the youth. So we started with a more advertising, which is a group that does a lot of public health advertising and campaigns. They worked with us and they worked with some focus groups of young adults throughout the North Shore who met with them and crafted some messages, tested them out with different groups, and came up with a message that simply says, if they can't buy it, don't supply it. And that's the overarching message that we want to put out there through the Sticker Shock campaign. So in order to assist the health departments and the communities with this project that's going to involve a lot of outreach to our stakeholders and to alcohol retailers in particular on Cape Ann, we've engaged Deanna Faretra. Sorry. Deanna is a public health nurse with a lot of experience with youth substance abuse prevention. She's the former health director in the city of Winthrop, and she's now working as a public health consultant and has joined our team to help work with each of the communities during each of the phases of this Sticker Shock campaign. So she's going to be the one actually helping each of us roll this out and work with our retailers and communities. So first of all, welcome Deanna to the show, to Health Chat. It's great to have you on.
Thank you, Karin, for having me. I'm really excited to be a part of this project and to be able to help the North Shore area with this important work.
Yeah, well, it's great to have you. And you've hit the ground running and got familiar with a lot of the players, and you've been to our coalition meetings and working well with the team, closely with the team at the health department to roll this project out.
Yes.
So Deanna, can you explain what Sticker Shock is and what the sticker is, and tell us a little bit more about it?
Sure. So Sticker Shock is actually a national campaign that the region has chosen to take on to address the data that reflected that the youth were misusing and potentially abusing alcohol due to their increased access. So the areas of Gloucester, Ipswich, Beverly, Manchester, and Rockport, and Essex.
Yeah. And I forgot Ipswich in the beginning, so I'm sorry.
All of the communities collectively agreed to support the data that they found that the youth had access and misusing alcohol, that they felt this was the best way to provide education to reduce the access. So the intention behind this national campaign is to raise awareness and education of the harms of alcohol misuse in youth. So the group has generated this sticker, which says if they can't buy it, don't supply it. And it reinforces the fact that not only is it an unhealthy choice to provide alcohol to youth, but it's also illegal. And you can face up to a year in jail and a $2,000 fine if you are found to be an adult purchasing alcohol for youth. So that the sticker reinforces that. And so the intention behind this,
That's great. It looks like a police badge. Is that intentional?
It is, because this initiative is supported by the local police departments and is being supported also by local school departments and community partners here in the entire region.
Great.
So to get I just want to kind of double back a little bit about the data. So you had mentioned that YRBS survey.
Yes.
So I wanted to talk about what
Great.
that is. So
Thank you.
how do we know that this is a problem?
Yeah.
So the way that the region looks at this is they implement a YRBS, which stands for Youth Risk Behavior Survey. So it's a series of questions that are very specifically designed to identify what the youth are facing from a youth perspective. And it does address and weed out any potential area for kids to manipulate the data. So at the end, each region and each community takes a look at what those questions look like. And that was how we found out that approximately 40% of the youth were potentially misusing alcohol and had access to it. So that was the first step that drove this initiative.
Yeah.
And now it's at the point where we have all of the lovely materials supported by the company Moore. And now we're going to go into the region, and the intention is to take the stickers and to take these lovely flyers. If you'd like to hold those up.
Yeah.
So we're going to be supplying local alcohol retailers and community partners both the stickers and these flyers to put into retail locations. And retailers, this is a voluntary initiative. So we will offer it to every liquor store that is across the region to participate. And if they choose to do so, then they can put stickers onto products where alcohol is usually purchased, like a wine cooler or something that might be especially alluring to youth. And they'll put stickers on the package to kind of raise awareness of purchasing this for youth is illegal and unhealthy.
Okay. So you might find in area liquor stores in the coming months, you might see the sticker either on the bag that you purchase or on the product itself, or maybe even on the cooler in which or the refrigerator unit, you might see signage that looks like this up in the stores. Is that what how it will work?
So each retailer will have the array of supplies offered to them, and they can kind of implement whatever they feel will be the best fit for their store. So it might be stickers on products, it might be clings on all of on like entryways and doors or on the coolers. There may be flyers in the window or available at the retail location to provide education. So any and all of these will be available across the area.
Great.
In addition to that, the group also agreed and will be getting T-shirts to support the initiative, so that the youth who will be visiting some of the stores, because there are youth groups that are really supportive and invested in this initiative, they'll be wearing T-shirts to go out and kind of raise education from a youth perspective in the different communities around what alcohol use looks like for them. And also adults and retailers. So the T-shirt, you'll begin to see these T-shirts in this yellow and black theme across the area to represent this project.
All right. Wow, that's really great. And approximately how many retailers do you know? Around 40 or so, did we decide in these 5 towns?
Yes. So in the area, there's approximately 40 or so retailers that are in the area, and we have about 15,000 stickers available to
It's a lot of stickers.
To get out into the area and to put onto products and to get out to retailers and to provide awareness to, as you mentioned, the target population of 21 to 30.
And Deanna, will you be visiting yourself each of these 45 or 44 alcohol retailers in this region?
So yes, I'm available to partner with every community member. And we have already begun to kind of have our mini coalition meetings, which is just the team meetings in each of the communities, because it looks a little different in each community. So yes, we will be going to retailers, we'll be going to schools, they may be doing some education campaigns. So you will see me out and about across this entire area.
Great. That's wonderful. Well, we really appreciate it. And I just want to, let folks know that someone from the community will be partnering with Deanna, and it might be a parent or someone from the school community, it might be a youth, who will be going with Deanna in to talk to the retailers and kind of help explain the initiative and why we're doing it and what it means and all of that. So we're looking forward to going out with you and, hearing how the retailers feel about the campaign, what they learn, what they tell us about what their concerns are, and then what you hear back from parents and the school community and police. So I also wanted to just add that this is part of a larger overall public health awareness campaign, that we know that that's really important in any public health initiative, to have the message be widely spread for a long period of time, and so that people see the message over and over. And that's part of why we've chosen such a bright color, that it's really branded, and we hope that people will notice it. And we will also be doing press releases in the local papers, maybe
social
featuring
media.
some local people, right?
Yes.
Social media. We all have Facebook pages within our communities. Some of the area police departments have Facebook pages, and they'll be posting this, helping other adults in the community, not just the 20 to 30-year-olds, but parents, grandparents, other stakeholders in the community who are concerned about underage drinking, to understand the project, get involved, and hear about what's going on and kind of raise awareness overall. So we're excited about that. Go ahead.
I was just going to say, another thing that I forgot to mention was that the group has made these lovely letters that will be going out to all of the retailers, and they will be shared regionally across the community to provide some general education to both retailers and community partners, so that people have an understanding of what the project is and they have something to reference, as well as some general data around the region of how this is impacting each individual community. And then the other piece I forgot to mention was the youth that will be involved in this campaign will be going through a special training around alcohol harms and youth access. So any youth that are engaged in the campaign will be provided education and trained on all of this material, and so that they can also share it with their peers. So they can go back to the kids within their groups and school systems and spread the word that alcohol use and harm.
That's great. And I know we hope to involve some of the area college students as well, who might be moving into that age group of young adults that we're really targeting as well. So I think that will be interesting to have their feedback and their perspective as well.
I agree.
We need to hear from youth as well. So
it's a collective. That's how we feel, that's how the group has felt it's going to be the most impactful, is making sure that everybody is on board, and it's a collective team effort regionally.
Good.
Yes.
And the regional component is interesting. So many of our grants now coming from either the federal or the state Department of Public Health are regional. So these towns you've just mentioned, we partner with on a number of different grants that we've received. And it's an interesting model in that we get to work outside our own communities as health directors and kind of learn from our other colleagues in other communities. But do you have any other ideas about how we might learn from each other by doing this project regionally? Do you feel like there'll be other benefits? Maybe the youth will work together across communities, or I don't know, I'm just kind of thinking about that in this project.
Well, I think that many people nowadays don't just stay insular within their one community. There's a lot of, partnerships. I mean, if you look at like Hamilton Wenham, it's a regional kind of school. So it's you're never just in your one singular community. So the more that you can spread a message that is going to benefit the whole area, the more likely you're to be successful and impactful, especially with such an important age group as kids. So
that's a great point. We do move around, and our youth move around. They shop in one town and they play sports in another town, and they do move around. And I think that's one of the nice benefits of a regional coalition, is that throughout the North Shore, you might see this message as the unified message. You might see it in a number of different places and ways, and that helps reiterate and reinforce the message as well. So
Absolutely.
We're excited about the project. We're really thrilled to have Deanna and her expertise on board, working with each of us. I know in Gloucester it will be a local parent who will be partnering with you to visit all of the retailers. But as you said, I think it's a little bit different in each community.
Mm-hmm.
And but we're excited to see how the project goes, how it's received, and what we all find out at the end of it.
Yes. So far it's been all very positive. Everybody's
Yeah.
very excited to participate and be a part. So
Great.
We'll see where it goes. And the only other thing I did want to mention is the timeline.
Oh, yeah. So when will this all be happening?
This is all going to be happening. The first round is going to be happening between January and February, which we're deep in the middle of it right now.
Yeah.
And so the second round will be going forward in prom season, which is in May. So those are the areas that reflected that the increase in youth alcohol use increases the most.
Okay.
So, because college kids are home around this time of year, and then preceding summer and the end of the school year and all of that. So those are the two timelines that we're going to do the big push, but they will be continuous throughout that time period as well. But those will be the more high profile time periods of the project.
Yep. Great.
So.
Very good.
Yes.
That's great. Well, we're looking forward to hearing more about how it goes, and we'll watch for these stickers and things in our community. So thank you again, Deanna, for joining us.
Thank you for having me.
And thank you for watching today. That's it for Health Chat for today, and we'll be back again soon. Take care, be healthy, and have a great day.
Thank you.